Hi, everyone. Good afternoon. This is County Executive Pat Ryan, and as you can tell, I am coming to you from a different location, trying to get a few days home with the family, so I'm actually broadcasting from our house here, and I hope everyone is having a good afternoon. I hope you're having happy holidays. I hope you can hear me. I hope this new technology is working, and thanks to Radio Kingston for making it happen. So we're going to do our usual update here, and we'll get started. Keep it relatively brief. To sort of summarize where we're at with COVID, we are still very much in the midst of the second wave, and my concern now is that with holiday gatherings happening earlier over the weekend, and then also coming into New Year's, that could really accelerate the spread of the pandemic heading into January, and that's obviously what we're working to prevent. Since our last update, which was on Christmas Eve, we have seen cases continue to increase to near record highs. We're at just over 2,200 total active cases, and we've had, tragically, through the holiday period, which makes it even more heartbreaking, an additional 4 Ulster County residents succumb to COVID, bringing us now to 136 fatalities. Total cumulative cases, as you could see on the chart, we're approaching 6,000, and testing continues to ramp up. Fortunately, the vast majority of people are recovering, thankfully, and we hope that continues. In terms of where we're at with hospitalizations, we are currently at 23 hospitalized. That's significantly up, of course, from during the summer, and probably we'll talk about this in a minute. But on the other graph, but we are also seeing an increase in ICU beds. We're now up to the highest we've been since April 30th. So that is something that we're closely watching. We will be able to add beds if needed, working with Health Alliance and Ellenville Regional and our other partners. But that's something concerning that we're watching. Looking at the next slide, which is our active case count, you can see that clear and now steep and sharp second wave. And as I said, we've been hovering right around 2,200 total cumulative cases in Ulster County right now. And that is near record highs, as you can see, over the course of the pandemic on the graph. The next slide shows the number of new cases. It also shows how many new cases we're having per day. And you can see, if you look at the right side, the right axis there, we're still at or near triple digits of new cases every single day, meaning that the pandemic is very much still at a point of community spread. And that is what we need to get back under control. To give you a sense of the last 96 hours since our last update, over the last 4-day period, we have tested 4,118 total county residents, and of that, 247 have come back COVID positive. So that's 247 out of 4,118, putting us at a 5.99% new infection rate. Probably more concerning is that in the last 24-hour period, we have had 80 new positives out of 716 tested. So in a 24-hour average, we're at 11.2% new infection rate. I always try to caveat that a 24-hour period alone, we shouldn't read too much into. So that 4-day average probably is a more accurate assessment of where we're at. But to see us spike to 11.2% for a 24-hour period is also reason for concern. Looking forward at the longer term cumulative projections, you can see here that we are now and still on that upward slope of the graph, and it's really up to us to try to get that back leveled off like we did in the late spring and early summer. Once again, we know how to do this. We have done this. And it's even more important that we do it again, given that the second wave, as we unfortunately feared, is much worse and more pervasive than the first wave. Moving to the next graph of our current hospitalizations and hospital capacity, you can see there the 23 currently hospitalized. You can see the 5 ICU and ventilators in use. And you can see that we do still have sufficient capacity there. As I said, we are watching that ICU number, but we do have the ability to add more there. It's more of actually a staffing issue, where we have the physical space for more ICU bed capacity. It's more, do our hospitals have the staff, which could be ramped up if needed. Moving on to the next slide. What do we do about this? We know what we need to do. I think the new information beyond the fact that when we're out and about in public that we need to wear masks and maintain distance and wash hands, we know that, we've been doing that. Those have been our main tools to control the spread to this point. But the new thing, or the relatively new thing that we also know, is how impactful social gatherings have been in spreading the virus, whether that's just a few people getting together, friends and family, and of course, any large gatherings creates even more risk. So we looking back saw a post-Halloween increase, which then was added onto by a post-Thanksgiving increase. The fact that we've had nearly 40 fatalities in the month of December, and we're not even through it yet, is directly attributed to those social gatherings that happened around between Halloween and Thanksgiving. So now we're at another one of those critical periods where between Christmas and New Year's, we understandably all want to get together, especially after this last year. But it's just absolutely essential that we not do that. And I know that makes for a more boring and lonely and almost sad holidays, but it would be much more sad to lose loved ones. And I think about the families of just those 4 that over the course of the weekend post-Christmas, 4 families that rather than celebrating the holidays were mourning the loss of a loved one. And now it's thousands of people in the county who have lost a family member or a friend or a colleague. And we need that. We need to come together to stop that and remember that spirit of taking care of each other. The other things that we need to do in the midst of the pandemic, in addition to battling, of course, the immediate fight of the virus, we also have to be working in parallel to protect our residents and our businesses from the economic pressures and all the other second and third order impacts that the virus has wrought on our whole community. So I want to give a few brief updates of what's happening really at the federal level, the state level, and what we're doing right here on the ground in Ulster County to make sure that we're protecting and taking care of our residents in a very cold winter, a very difficult winter. And there have been some encouraging developments on that front. So I want to quickly hit on those with a little bit of optimism and also reinforce that we are and will continue to be here for our residents through this crisis. Sort of over the weekend and into earlier this week at the federal level, we did finally see some progress in getting a relief bill passed at the federal level that currently has a whole bunch of provisions. Probably most impactful to residents will be, at this point, a $600 payment below a certain income threshold, as well as billions of additional funding for businesses, funding for schools, which will be critical, and some funding as well for some at the state level for vaccine distribution and other public health needs. What's playing out right now, though, for some of you that are probably following this, there is an effort led by the House, and actually a bipartisan effort, to increase those stimulus payments from $600 per resident to $2,000 per resident. That is something that would be hugely impactful, as we know, for the thousands of families in our county who are struggling and have been struggling for almost a year now. So I strongly support that. I know our members of Congress have been pushing for that, and you've seen even many Republicans that had been opposed to this pushing for it. So hopefully that was passed in the House yesterday, and hopefully can make its way through the Senate. Unfortunately, with Mitch McConnell there, that's where many of these necessary things often lose momentum. So we hope that humanity really prevails and that people understand how great the need and the pressure is right now. At the New York State level, there was a huge progress and a major piece of legislation passed yesterday and signed late last night by Governor Cuomo. Essentially, and I want to applaud the governor, I want to applaud our state legislative leaders in the Senate and the Assembly coming together and convening on yesterday, the 28th, and passing landmark legislation. And really, at the very simple level, what it does is make sure that in this winter, with the pandemic, no one is without a roof over their head. No one is forced to be kicked out or evicted from their home. And that is a very encouraging development for millions of families in New York State, thousands of families here in the county. I'll put up some details. There's a lot of words on this slide here. These are the main provisions of that legislation. Again, passed at the state level, the Emergency Eviction and Foreclosure Prevention Act of 2020. Basically, it does three big things. Number one, it extends a statewide moratorium on evictions until May 1st of 2021, bringing us through the winter and into the spring for anybody that's been impacted by COVID. So if you have lost pay or been financially impacted, which I think most everyone has, you can be guaranteed to not lose your apartment or be evicted until at least May, and that is a huge sigh of relief for so many. Additionally, for our residential homeowners as well as small landlords, which we have many of in the county, and we're defining small landlords as anyone with less than 10 units or dwellings, you are also protected by this, and you can file a hardship declaration with your mortgage lender or the other appropriate authority to make sure that there's no pressure on you. So we're not only protecting renters and residents, but also making sure that our small landlords who have also been devastated by this pressure are able to keep their operations going, and really everybody benefits from that. The third component of the legislation is that for our seniors and disabled members of our community who have special tax exemptions in New York State, normally you have to go renew those in person. Has been those exemptions have been automatically extended without having to refile for the next year. So that is another sigh of relief for many in terms of some economic relief. So again, I want to thank our leaders at the state level for pushing this through. And finally, at the local level, here in Ulster County, we are also acting and doing everything that we possibly can, particularly to protect our vulnerable members of our community, those that were already living paycheck to paycheck before COVID. And the main mechanism we're using to do that is our Project Resilience effort. We are reactivating Project Resilience heading into the winter. The next phase focused really on three main categories of folks, wide categories, but our seniors, particularly our homebound seniors, our young people who have had so much pressure and so few supports during this time period, and then also our hundreds of families in the county, as I said, that are and even were before this living paycheck to paycheck and may not have any income right now, figuring out how to get direct relief to you all to complement what's being done at the federal and the state level. So we've raised nearly $1 million of all philanthropic community funds for this next round of Project Resilience. We've started rolling that out with senior meals, and we'll be continuing to spend and roll out that money to help our Ulster County community. And I want to thank everyone that has contributed to that. If you are able, as you're thinking about any final end of year charitable contributions, if you're able to support Project Resilience in any way, that those meals and those services and programs are all going right to your neighbors and friends and your colleagues and your family in Ulster County. So that page is back up. It's through the Ulster County United Way, the Project Resilience page. We have seen those donations, even in the midst of the holidays, trickling in. And again, if you are able to help in any way, you can look up Project Resilience, Ulster County United Way, and contribute online. You can also get to that giving page through our Ulster County COVID-19 page. So thank you to everyone that has given, and to those that may in the future. Thank you in advance. I know Rebecca and I made one contribution in the last round, and we're going to do another one here in the next few days. And really, every dollar helps there. So thank you very much. Those are the main updates. I wish there were better news to share in this holiday period with the pandemic, but as I said, I always want to be candid with where we're at, and we are in a place of grave concern as we see all the statistics going up, and we know that the gatherings around Christmas and Hanukkah and other winter holidays, as well as New Year's coming up, could really sort of, as Dr. Fauci has said, contribute to a surge upon a surge. So that's what we're working to prevent. As you're making your New Year's plans, please think about being boring. Please be okay with staying home, watching on TV or online or whatever you can do, with really just immediate family, if at all possible, and use other virtual ways to connect with folks. I know it's hard, but we know that on the other side of this are widespread vaccines. We're already distributing some of the vaccines in the county, including this week to our EMT and other first responders, thankfully. So that is the light at the end of the tunnel, and let's get through this winter. I'm particularly thankful, as I've had a few moments to reflect and spend time with family, for everyone that has gotten us through this crazy year, absolutely crazy year, one that none of us anticipated. But more than anything, I actually had to run out on Christmas Day and grab something at the store, and I thought about our workers there that were not only working on the Christmas holiday, but were doing so at risk to themselves and taking on that risk to make sure that our community can keep running, and have all these essential services, from food to deliveries to public transportation to keeping us informed and providing medication as we ramp up our vaccination efforts. Our whole team that will be doing that, of course, our teachers that have been going throughout this entire year in such challenging conditions. So thank you all, truly thank you for what you've done, and we're not through it yet, so hang in there and keep doing it, please. We will wrap with that. I want to thank Radio Kingston, and thanks Diane as well. We're trying this virtually here, and I think hopefully it worked out. Our next update will be on Thursday at 2 p.m. again in this format, and then the following week we will all be back in the normal mode. If you or anyone you know is in need, please reach out and contact our Recovery Service Center. Our team is here to help. County government in particular, we are the ones that really, I think, are here to protect the most vulnerable and those in need, which are so many right now. So please, you or others you know, don't hesitate to reach out. 845-443-8888. Thank you. Stay healthy and safe, and we'll see you on New Year's Eve. And in the meantime, please continue to be resilient and take care of each other. Thanks.